I have some statements about autism, and I would like to know if those statements are a myth or a fact.
That's very interesting, and I think that's also very important. So tell me, go ahead.
So the first statement is, do all people with autism have intellectual disabilities?
That is not true. That is a myth because autism is a spectrum disorder. So every individual with autism have different kinds of symptoms and they are on a different range. So some might be average or above average with intelligence, whereas some might have intellectual disabilities.
Okay. Next one is, autism is a spectrum and every person is unique.
That is very true, and that is a fact. Like I said before, it is a spectrum disorder. So when we say spectrum, the individuals are on a range. They could be diagnosed with autism on a severe range or mild or medium.
Okay, so that's a fact.
Yes.
Okay, so the next one is, children will outgrow autism as they get older.
That is not true. It is a myth because autism is a neurodevelopmental lifelong condition. So it stays, but with the right kind of therapy and support, children can get better at the skills and the things that they are strong at, but it is not something that they grew out of.
Okay, so that's a myth. So the next one is, early intervention can help with development and skills.
Yes, that is very true because the earlier the kids are diagnosed and the intervention starts, that can help them develop the skills. And with intervention, I mean therapies like speech therapy, occupational therapy, or applied behavior analysis, which is behavior therapy that we specialize in. So these all help with the development and covering the gap.
So out of all the three therapies that you mentioned, which one would you say affects the more or like helps the kid or individual more?
So we cannot particularly say one because all three focus on different skills. Speech therapy is more inclined towards communication, speech, words. Occupational is more related to the gross motor, fine motor skills, and behavior therapy covers most of this, as well as dealing with challenging behaviors, sensory sensitivities, and other things as well.
So that's a fact.
Yeah.
Okay. And the last one is, people with autism don't want to form relationships.
No, that is not true. It is a myth. They might face challenges and they might face difficulties forming relationships because sometimes it's difficult for them to understand emotions and express emotions. But again, as this is a spectrum disorder, every individual is different. Some are very comfortable forming relationships. So that depends from individual to individual.
So that's a myth. Okay. Thank you so much, Leena. I hope all this information will be helpful to many people and clearing all the doubts that they have in their mind about autism. Thank you so much.